Now, I've got a message in from the wives and partners of the Defence Forces. I will read that out in a few minutes, and some other messages regarding the issues that we have sent in this morning. One important one is, I think Frank Quinlan should get the award for all the marathons he's doing. Imagine doing 21 kilometres every day for 21 days. Phenomenal amount of work. And I want to give a special mention to Geoff Plant, who's going to be talking to us about our medical matters. So if you want to text in, please, any questions regarding medical matters, please do. 083 3333 975. And I sent a message earlier on, just after 10 o'clock, for Maria Gleeson. Happy birthday to Maria. Maria wasn't listening at the time, but a special happy birthday to Maria, and I know she's listening now. Lots of love from her husband John and all the family: Martina, Carol, Dee, Catherine, Patrick, Dwayne, Nick, and grandchildren Adam, Chloe, Emma and Amber. Geoff, good morning.
Good morning, Damien. How are you?
I'm good, thank you. I'm good. Can we get down to a few specific questions, if you don't mind, just for a start? We'll go straight into it. Good morning. I'd like to ask the doctor, I'm cocooning for the last 6 weeks now. I can't sleep. I'm crying a lot. I'm thinking about the past, and now it's taking all my strength every morning just to get up. Just to get up out of bed. I miss minding my grandchildren. I was a very active person, walking 6 miles every day. I'm only 70. This is driving me mad. Thank you, doctor. Like, that just is so sad, and that sums up in such a small few words an enormity of what many people are going through.
Yeah, absolutely. I think it does, and my heart goes out to the listener and to anyone else who is cocooning at the moment and finding it difficult. Mental health is definitely being affected. There's no doubt about it. And what can she do? Try to keep active. Try to keep the mind busy. Try to formulate your day better, as in kind of almost timetable out your day. If she's feeling very low, she can pick up the phone to her GP and chat. Normally, Damien, you'd be suggesting counselling and, self-help kind of remedies there, exercise, but it's a little bit different at the moment, isn't it? But talk to her GP if she's very low. As I've been saying a load, we are open for business. We are seeing patients. We are talking to patients on phone. It does sum up where we're at, though, doesn't it, Damien? This is where we're at. We're at a battle, and the battle means that people need to cocoon to stop the spread of this virus and stop deaths. And this is the constant seesaw we're at. The trade-offs we all need to sacrifice at the moment in order to beat this disease.
Yeah, and we just had Minister Paul Kehoe on earlier saying that it looks like the restrictions are not going to be lifted in full. We don't know how much they will be lifted, if anything, next week, because the figures are still going up. Well, there's still hundreds upon hundreds of confirmed new cases.
And I want to emphasise this to everyone who's listening today. We have not beaten this. This whole thing of, we're now going to lift restrictions and go back to normal. Now, I know the Minister has said it as well. I think the restrictions will be lifted very, very slightly at a time. The numbers are very high still. And all we've done, in my opinion, is we flattened the curve, which is fantastic. Well done, everyone, particularly in Waterford, but well done, everyone in the country. But we haven't started going down this hill yet. So the numbers are very high and staying at a level. And we haven't got rid of this. So we need to keep going. And there's huge sacrifices being made economically, obviously, of course, huge. And then on personal level, like your last listener there. But this fight is still to be fought. And it's a long, long way from any sort of a victory in Ireland at the moment. And hence, we need everyone to keep going. And this kind of thing that, it's been fought by frontline workers and stuff. Now, frontline workers are doing their best, and we are seeing patients, and my colleagues in the hospital are seeing patients and sick patients with coronavirus up in Dublin, the ICUs. But the real fight is still at the individual level, and everyone doing what they're meant to do. I've heard reports over the weekend, I'm sure people have been texting in there, Damien, but barbecues happening, people getting together in parties. This is my fear. It's slipping, and it's slipping quite quickly. And I now know why. We've talked before, is why was there restrictions not put in earlier? Because compliance starts dropping. But can I appeal to everyone, please? This is so important. Lives are at stake here. Everyone's done brilliant so far. We need to keep this going, and the sacrifices are hard. We need to keep this going.
OK, a couple of specific questions. I'm on a cholesterol tablet. Can I eat foods with high cholesterol because I'm on this tablet? Does that make sense?
No. So if someone is on, this is the first non-coronavirus question in a while. I'm delighted to take that question. So, so this. If you're on a cholesterol tablet, you're on it to try and reduce your risk of heart disease, heart attacks and strokes. It means your cholesterol is high, but it only is safe in conjunction with a low cholesterol diet, a healthy diet. So the answer to that question is no, you shouldn't be. You should have a very healthy diet. You shouldn't be eating products very high in cholesterol. Now, you can always treat yourself maybe once a week or something like that, but in general, your diet should be low in cholesterol, high in fibre, high in fruit and veg.
Okay. Doctor, can I mind my 2-year-old grandchild for 1 or 2 hours during the week? Her mother is a nurse. I'm over 70 years of age. I'm in good health. That's from a Dungarvan listener.
Great question. And if she has been cocooning to now, the answer is no, as per the regulations, and this is important. And this sounds like I'm being very cruel, particularly given that her daughter is a nurse. No is the answer. This is where the thing starts slipping. If the children are asymptomatic, or maybe someone has been in contact, the over 70s are extremely vulnerable. Hence, they're being asked to cocoon. They're the ones that we're trying to protect here, and people with chronic illnesses. So as it stands at the moment, Damien, and to that listener, my apologies, is no, she shouldn't be minding her grandchildren at the moment. And that, again, that's another sacrifice, isn't it? Yeah. Both for the nurse, her daughter there who's working hard and needs her children minded, and for the grandparent who is terribly missing her children, and I'm sure she's dying to look after her grandchildren. Yes. But no is the answer at the moment, and it's to try and stop the spread of this. It's trying to get rid of this virus out of the country.
Another text: is it safe for healthcare workers to carry other healthcare or medical professionals in their car on journeys to and back from work? Just thinking, if one coughs or sneezes in the car, could be asymptomatic and doesn't know it, they could pass it on in a confined space and then on to possibly vulnerable people with underlying health problems.
Yeah, as far as I'm aware, the answer, again, and this is my assessment of the situation, having read guidelines, is the answer to that is no, they shouldn't really be sharing cars at the moment. That's a very small space. If you're sitting beside someone in a car, how many metres are you away? I'd say 0.2 of a metre or something like that if they're in the passenger seat or behind. So you need to be social distancing. So that listener is correct. If you're a healthcare worker and you're in a car, you can't. If you accidentally sneeze, you could be spreading it. There is more and more evidence coming out, Damien, about the asymptomatic spreaders of this. So people have no symptoms at all, but yet have the disease. We're still early in the research, but they're saying up to 40 or 50% could. Now I'm going to use that big word, could. Be asymptomatic and have coronavirus and spread it completely unbeknownst to them. And you think about, this is where we're trying to save people's lives, is we're trying to, because when people get this and they get the symptoms, you have a fever, you have a cough. Now, I think most people at this stage, I hope, would know, oh gosh, we need to isolate at home and keep yourself to yourself as per the HPSC guidelines, isolate at home. But it's this asymptomatic group that we're still unaware of how long they're asymptomatic. We think they're asymptomatic for about 2 days before they get the symptoms, or they can be asymptomatic for longer and not get any symptoms. So this is the fear, and this is where this virus is still unknown. So that person in the car, Damien, could, in theory, spread it unbeknownst to someone else. And if it's two healthcare workers, that's two healthcare workers off the lines. And not helping people in where they should be on the front line, unfortunately. Two
non-COVID questions. Sciatica, I have it for around 2 years, says this person. Is there a cure for it?
No. 2 years. That's no. There isn't a cure. I've talked about back pain a few, and sciatica, for your listeners who don't know exactly what sciatica is, it's basically back pain that shoots down your leg, and whoever is listening has it. They know very well what it is. So sciatica for most people and back pain will last a maximum of 2 to 3 months, which is great news. 80-90% of people will get it. It's very debilitating, very bad. Often lasts a couple of weeks, but can go up to 2 or 3 months. Then there's the people who get it, like that poor listener, who have it long term. Now that's very difficult, and there's a multitude of things that can be done. The most important thing is physiotherapy and exercises. That has the most evidence behind that in terms of its effectivity, how good it can help you and help your pain and help get rid of it. So physiotherapy, exercises. After that is pain relief from your GP.
Yes.
And after that, unfortunately, there's stuff with little evidence or not that great evidence. For example, surgery in some cases, but that's quite a small, I understand, about 5%. And then after that, there's all sorts of other things, acupuncture, alternative medicine, and then things like injecting into the joints under special CT guidance. So there isn't a one cure fits all, but I do feel for the people who have sciatica long term.
Yeah, because Breda then phoned in to say she's a pain in her shoulder down to the elbow, on the inside of her arm and under her arm. It's like an achy pain, can't sleep at night with it, wondering is there anything she can do with it. Again, that's something that maybe a physio might be able to look at, but people aren't able to go to physios. For example, yes. Another texter says, my mother is just 80, always had her physio every week. She now has chronic pain in her back. So this is affecting people that way as well, isn't it?
It is, and can I appeal to people, if you're not, people who are not IT savvy are suddenly becoming IT savvy, and it is difficult for the over 70s and over 60 people, but try and get help and I understand there's helplines of volunteers helping people to log on to Facebook and YouTube and stuff like that, but there's brilliant videos on YouTube for all sorts of physiotherapy exercises, and perhaps logging onto that and trying to learn your exercise to do them at home. Most people who've been to the physio many times will have learnt their exercises and know what to do, and maybe even be given instruction leaflets. So keep trying to do them at home. Yes, it doesn't replace the going in, but try to think outside the box and try to do as much as you can in the home.
Okay, listen, mind yourself, Geoff, and take care, and we'll talk to you again soon, okay?
Thanks, Damien, and big appeal to everyone, please comply with the regulations, the social distancing, the hand washing, covering your mouth. That's another big one. I know you've asked me about masks before, Damien, but trying to cover your mouth when you're coughing and sneezing is vital. Even putting a scarf over your face going out in public and going into shops, I think, is a good idea. The evidence is changing there. But we need to keep going here, guys. We're slipping. It is vitally important. By complying, we are saving lives. We've done so well in Waterford, and that's thanks to everyone's hard work. We must keep it up, and it is saving lives. It is saving lives. So please, everyone, keep going.
Geoff, thank you, and mind yourself. Take care.
Thanks, Damien. Bye-bye.
Thank you. Bye-bye. Dr. Geoff Plant there with some medical advice. Now, getting a considerable amount of texts coming in from different people. I want to read out a message that came in from Shelley Cotter. She's spokesperson for the WPDF Wives and Partners of the Defence Forces. She was listening to her interview with Minister Paul Kehoe this morning. Again, I want to thank the Minister for talking to us. But this point that Shelley makes, and a number of other people have texted us as well. The Minister, she says, completely missed the point. Again, he isn't... let's see here, sorry. The Minister, she says, completely missed the point. Again, he isn't the Minister of all other countries, so it shouldn't matter what they're doing. He's Minister of the serving family members, and de facto the only contact with the Defence Forces families here. So instead of talking about other countries and what they're doing or what needs to be done, he needs to be talking to us, she says. Tell your own families, your own people, about the turmoil that they are in across Waterford, the South East and Ireland, and the children who are anxiously waiting so much and are at home cocooning or stressed out, and they have this added stress. So she's calling for the Minister to reassure and talk to the family members, and that there should be a lot more interaction with people from that matter. A few people texting saying that, what about fruit pickers were allowed back in and they can't bring the troops home? Again, the Minister explained that was a different scenario. This is coming from the United Nations. The Irish troops are commandeered and working through the United Nations. So it's a United Nations tour of duty. That's the issue that comes in with this. Damien, I can't understand people coming down from the north and I can't go outside to go for a walk. Another person, Bill, says, in Verybank, the Minister says we'll stay the course. How the hell, says Bill and others, could the government not have sorted out the laws so that citizens from the north would be taken in as part of the laws, as well as people from the south as well. Good morning, Damien. Did you see the Waterford Cork match last night on the telly? What a match! Some great memories to keep us safe. Keep up the great work. Others saying about the gambling situation, that there's a lot of gambling going on at home online. Amazing, says this texter, that all parties were so negligent to pass legislation in relation to travel within the country, but not include Northern Ireland. And regarding the Leaving Cert students are a lot worse. How the hell can anybody expect them to sit exams at the end of July with no school? It's disgraceful. It should be cancelled. Assessments should be brought in, says that other texter. Damien, will you ask Geoff, if you get COVID-19 and recover, can you get it again? That text only came in, Larry, in the last few minutes. Sorry about that. My understanding, looking at reports over the weekend on the testing they're doing in South Korea and different places, that there is some evidence that you may be able to get it again. That the antibodies that are there, but that's not conclusive. That is not conclusive there on that. Liam has texted in to say, I feel so sorry for the wives and partners of the Defence Forces. Can you also highlight mental torture of people affected or suffering the consequence of parental alienation? This has become a major issue, says Liam, suffering for months and even years with no contact with different members of the families. And other people asking about different particular health matters. Stay with us, because we're going to be talking about a big survey of 35,000 people that said they'd like to see the 2 kilometres restriction on movement and small gatherings removed. And this ties in with some people saying that if all those figures, how many of those figures, the increase in confirmed cases, are they coming from nursing homes? So, for example, people are saying, it's just a thought on my part, says this texter, I'd like to know how many of the 701 new cases are within nursing homes. If the majority are in nursing homes, then surely it shouldn't affect some sort of lifting of restrictions. That's a very good point, very good question. We're going to talk to Dr. Aki about that in a second. And also a texter, I'm 63, I'm in good health, my grandson is 9. Can I go for a walk with him and stay at the 2 metres distance? 083 333 975. Now keep your texts and comments coming in. I'm going to be talking to a senior I knew I get it wrong, epidemiologist from Galway in a second. Firstly, some texts and comments. Could you please wish Mary and Dixie Flynn a happy wedding anniversary, 52 years married today. Happy anniversary, Mary and Dixie Flynn. You're in Lisduggan, and want to wish you the very best. To everybody out there that is cocooning and staying together, it's so difficult, and just stay the course. Eddie Barry has texted it in that there is a health drink that he got from a book many years ago. 7 ingredients: milk, yoghurt, brewer's yeast powder, Engavita, wheat germ, mixed ground oats, 1 ripe mixed banana, mish it all together, blend it all together. It helps your mental health. Could you find out this morning, is the People's Park closed? Yes, as far as I understand, it's closed today for essential maintenance. And a number of people texting in about scams that are going on, possibly on social media. Mags texted in to say she had discs removed and suffered sciatica a lot, and found a golf ball in the back pocket of the jeans. Roll exactly in the area, and that can help a lot. Now, good morning, Dr. Aka Felinga. Is that correct? Senior lecturer at NUIG.
Yes, that's correct. Thank you, Damien. Thanks for having me on.
Not at all. It's a pleasure to have you on. And I promoted this just before the ad, saying that it's as a result of a survey of 35,000 people by the National University of Galway and DCU. It found that most people would like to see the 2 kilometre restrictions on movement and small gatherings removed. Tell us about this survey, please. How did you manage to do it?
So we started the survey actually 2 weeks before that, and we have already 140,000 people that have done this. So on the 8th of April, we asked people to fill out a survey for a 24-hour period, and we repeated the survey then again on the 22nd of April, with the results of which you are looking at now. It's the nationwide survey, and we've got some fantastic responses. And yes, one of the results is that people were asked to rank which of the restrictions they would like to see lifted first. And the first one that came out of that was the 2 kilometre restriction.
And I know the phone line isn't great. Apologies about that. It's the only phone line that you have there at present. Would people, or did you give people the option or the question to say, let's move it up to a 5 kilometre restriction, or what sort of scenarios are envisaged?
No, it was a survey is a very crude instrument, and especially with so many thousands of people getting involved, we could only ask them to rank the 5 restrictions that we gave them, which was the 2-kilometre restriction, meeting of small groups, open schools, being allowed back to work, and open retail and pubs again.
Okay, and what about the fact that the number of confirmed cases is still going up, Doctor? Like, what's your own view about this?
Well, the number of confirmed cases might still go up. We don't actually see that in our survey. We actually noticed between the 2 surveys that in the first survey, 6% of the people were saying they had flu-like symptoms, and this time around it's only 2%. And 17% knew somebody who had flu-like symptoms, and this time around that's only 10%. So we see that the restricting of people and people remaining at home and not interacting with each other has an impact on how the flu-like symptoms are spreading or stop spreading, to be clear.
Okay, so what do you think the government is going to do? I know that's a crystal ball question, and we hear the government saying they're not going to totally lift the restrictions. There may be no lifting of any restrictions. Maybe they'll loosen them a little bit, but what do you think is going to happen?
Well, it's a very difficult position the government is in, because every kind of restriction they are going to lift, they will only see the results of that 2 to 3 weeks later. So it's a very slow process, and people feel that also as a very slow process. So if they are lifting any of the restrictions and increase, for instance, the radius that we're allowed to move in, then we have to wait 2 to 3 weeks to see that in the actual numbers, and only then they can think about what's next.
Okay, good point. Listen, Doctor, it's a pleasure talking to you this morning. As I say, sorry about the phone line, but listen, take care and excellent work. Fair play to you.
Thank you very much, Damien.
Thank you. Very good. Dr. Aka Falinga, she's a senior lecturer at NUIG, and that's the results of 35,000 people, NUIG and DCU in Dublin, saying that there should be some loosening of the restrictions. What do you think? We've had a text in, keep the 2-kilometre restrictions in place in small gatherings. That's what people want. If we don't have that, we're going to have stupid things happening, especially at bank holiday weekends, and the place will be packed and all this will be for nothing. Another person saying, no, there should be some little bit of restrictions lifted. Another texter, if people with holiday homes are not allowed to travel, how can it be all right for people from Northern Ireland to travel to their holiday homes here? It beggars belief, says Kit. Now, regarding healthcare workers sharing cars, here's a good one. If it's not right for healthcare workers to share a car, why should they share an ambulance? Hey, very clever. Mary's texted in, I'm 69, I'm minding my grandson as a mam is a lone parent. Am I okay to do it? Well, you've heard what the doctor had to say, Mary. Recently, a person is asking about a bunion which has been discovered. I'm not going to give any advice on bunions. I'm afraid I'm not qualified to do that. Damien, seeing people definitely a lot more in supermarkets on Saturday morning. They were getting in and out as quickly as possible, but 3 people chatting in one aisle. Trolleys overflown, holding up the queue. If this continues, we will see no lifting of the restrictions. A number of people texted in about Cathal Berry. He's a TD up in Kildare, a former Army Ranger. We've contacted him this morning. He's going to be coming on the programme tomorrow. We're also going to have a fiancé of a Waterford soldier who's in the Lebanon, who is very, very upset and annoyed and sad and angry about her fiancé not being told yet when he will be coming back. Stay with us. Now, a very good, simple question there. Somebody said if they are going to be talking about allowing small gatherings, what quantifies as a small gathering? Yeah, that's going to be very interesting. If they are going to say you can have a small family gathering, how much is a small family gathering? I've a 21st in our family soon, says this person. I was just wondering, will it be completely cancelled? We also had a lot of people texting over the weekend about confirmations, communions, religious ceremonies, and where that's going to go. So we're going to try and contact the dioceses this week to see what is the situation. Are there any plans for communions and what's happening there with that? Is it going to be next year? Will they all put back next year? We just don't know. Now, Dr. Linda Gordon, she is a chief specialist in microbiology with Safe Food Ireland. Now, Safe Food Ireland basically advises people on what to do, I suppose, with packaging and all that sort of stuff. So, like, do you wash down your cereal boxes when you bring your grocery shopping home? I'm going to find out now. Dr. Linda Gordon, good morning.
Good morning.
How are you? Are you keeping well?
I'm good, thanks, Damien. How are you?
I'm good. I'm going to ask you in a minute, do you practice what you preach? I'm sure you do.
I try to anyway, but none of us are perfect, I think.
Yeah, well, we'll get an example of
intentions.
Yeah, we'll go through that. You're chief specialist in microbiology with Safe Food. Now, Safe Food is just explain to people what Safe Food is. Is it a government organisation?
Yes, it is indeed. In fact, it's one of the North-South bodies set up under the Belfast Agreement. So it's a cross-border body, and we're involved in promoting food safety. So we're not involved in regulating or anything or inspecting, but we're involved in promoting food safety both to consumers and to people working in food.
And one of the things that you've been quite adamant about over the last 5-6 weeks in particular is how consumers are, one, consuming food and then obviously purchasing food and storing food and things like that. So there is a myth out there that you have to wash everything. You have to disinfect everything before you put it on the shelves at home. What is your message regarding food shopping, Linda?
Our message regarding food shopping is that the risk of contracting the virus from food packaging is very low, and that good hand hygiene is the best way to control that risk. So it's not necessary. I don't want people to be thinking, I have to disinfect all my shopping, or, if I don't do this, I'm putting myself at risk. The main thing to remember is before you leave the house, wash your hands. Then when you get to the supermarket, most of them have put in facilities for using sanitizer or for washing your hands even at the entrance, and also for disinfecting the handle of the trolley. So I would encourage people to make use of those facilities. Then as you're going around, remember, to avoid touching your face, which is one habit I think we're all finding difficult to break. But if you're conscious of that, don't handle food that you're no intention of buying. And then as you go through, when you come out of the supermarket, you may have the opportunity to sanitize your hands again. But either way, when you come home, wash your hands straight away, then unpack and put away your shopping and then wash your hands again.
There are some people that take extra precautions. So they'll buy a cardboard box of some particular food product. Let's say it could be cereal. And they decide when they get home to give it a rub down with maybe some sort of a wipe, That might, just for their own extra peace of mind. Is that a good thing to do? It's not necessary, as you say, but
No, it's not necessary. The kind of surfaces in laboratory tests that the virus is surviving better on are plastic or hard surfaces, not so much on things like cardboard. But however, I do understand some people are going to choose and they're going to feel happier if they want to disinfect everything. So I would say if you are using disinfectants and things, use or diluted bleach or something. You read the instructions first, so use them in accordance with the instructions, and don't mix bleach with other chemicals and things like that. And some of them will tell you that they need to stay on the surface for a couple of minutes before you wipe them off, so they might not be effective if you just spray something on and then wipe it off immediately. Now, I suppose it's quite a big undertaking to disinfect all your shopping when you bring it home. So my concern would be, first of all, that maybe people would leave things that need to be in the fridge out of the fridge for a while. And so I would encourage people to get any perishable foods into the fridge or the freezer, as soon as possible. The other thing is, I know myself that if I had to think about disinfecting my shopping and manage all that when I come home, there's a good chance that I might forget to do something like wash my hands or something in the middle of it all. So I suppose that's, one of the reasons we're focusing on the most important behaviours, which are around hand washing, social distancing, not touching our face, etc. I think if we get those right, we're giving ourselves, excellent protection.
Yeah. So when you have your bag of groceries, you open the front door, you get into the house, put the groceries down, put the bags down, go straight over to the sink, give your hands a good wash with soap and water and whatever the case may be, and then maybe use a little bit of wipes on your hands as well. Then put away your groceries. Is that what you're saying?
Yes, and after you've put them away, wash your hands again, and that will give you that extra bit of protection.
And do you do that yourself?
That's what I do myself. Yeah, I don't disinfect everything. But like I say, we all forget. And I have come into the house and it got distracted by something and thought after a few minutes, God, I never washed my hands. It's no matter how well informed we are or well intentioned we are, it's very easy to get sidetracked and make a mistake. So I think if we give ourselves too many things to remember, that it's more likely that we'll get something wrong.
Yeah. Now, last month saw the biggest amount of grocery sales ever recorded. Irish people spending €122 million on groceries. That's an increase of over a quarter. And obviously a lot of groceries online, 1 in 10 placing an order in the 4 weeks up to March, and then takeaways as well. What about takeaway boxes? What about on a Friday night, on a Saturday night or any night you go and order a takeaway either from a Chippers or from a pizzeria? Does the packaging need to be disinfected?
Well, again, similar to when you're buying something in the supermarket, the risk of transmission of the virus from packaging, there's been no reports of any transmission of illness through packaging or through food, and that's also the case for previous, similar viruses such as SARS. So just to reassure people about that, the risk is very low. Again, food companies, like whether they're takeaways, whether they're in supermarkets, they have to adhere to very good hygiene standards. They have measures to put in place to, make sure that staff are following the hand washing and respiratory etiquette and all of that. So use a takeaway that you trust, that you normally would be confident in their hygiene standards. A lot of them are doing payment over the phone, so you can avoid, handling cash or, handling card payment machines. So if you can do that contactless payment, that's great. It might be a good idea if the person delivering it leaves it at the front door and then goes away. So again, you're kind of making sure that you're keeping your distance from that person. So, unpack the food and wash your hands. Get rid of the container and then wash your hands. So, just washing your hands after you've handled the container should be fine. And again, the virus will be killed by food being cooked properly, so you don't have to worry about the food itself.
Some people have been texting in about money, for example. You mentioned handling money. In your experience, and again, looking at the science behind this, there's different degrees of analysis about the half-life of the virus, as they call it, how long the virus may continue to exist and the strength of it on certain surfaces. Have we any indication regarding money and banknotes?
I'm not aware particularly in relation to money. I know that some of the work done showed that it didn't survive as long on cardboard and things, than it did on harder surfaces. So It seems to be surviving better on harder surfaces. Again, the risk is low if you can reduce the risk by, or eliminate that risk by using contactless payments. Otherwise, again, it's back to good hand hygiene if you can't avoid using cash. But again, it's not a huge area of concern. But everything we can do around hand washing and kind of to reduce our contact with other people will help.
Do you think people are doing fairly well, Dr. Gordon?
I think, I suppose from the point of view of somebody who's a food scientist, not a public health doctor, but somebody who works in food safety, and we've always been talking about hand washing and the importance of it. So, now it's taken on new importance, and I think a lot of people are doing very well. And people are very conscious about it. I think there's a lot of anxiety out there as well, so that's why we're trying to give a little bit of reassurance to people. But I do think that, people I can see myself when I go to the supermarket, the vast majority of people are being careful, are using the hand sanitising facilities and are keeping their distance, etc. So I think most people are doing their best.
And what about, finally, the workers in the supermarkets and in shops? A lot of them don't wear the gloves now because, again, the gloves can maintain, or I suppose keep the virus on the glove. So you see them, they'll put through shopping from one person, then they might just turn and give their hands a quick wipe with some of the disinfectant. That's the best way of doing it from a perspective of a shop worker, is it?
Well, gloves, as I say, aren't perfect. They don't give you immunity. They can give a false sense of security. So you can transmit the virus. They can pick up the virus, as well as your hands can. So I think most shops are providing hand sanitizer and things like that. So when you're, they're very busy, the people working in the shops, and I think the majority of them are using hand sanitizer, and we're lucky that hand sanitizer is effective against this virus. So if they're rubbing their hands with it between customers, then I think that's probably giving us the protection we need.
Dr. Linda Gordon, thank you so much for joining us, and stay safe for you and your family.
My pleasure, Damien. Thank you very much.
Thanks, Linda. Thank you very much. Mind yourself. A couple of texts. The doctor said earlier that lady can't mind her grandchild, so who's minding all the children? All the creches are closed. I mind my 5-year-old grandchild 3 days a week. I always did. My daughter has to work. She's a single parent. I'm under 70. Another texter, does social distance apply to members of the Gardaí while on duty? I was in Little in Dungarvan yesterday. There were 2 members there. They weren't even 2 feet apart, let alone 2 metres. Unfortunately, Damien, regarding small gatherings, if we give an inch, people will take a mile. I can't see this happening. Paddy was on, giving out about Dr. Aki from Galway. Get her off the airwaves. There's 30 to 40 people dying every day and hundreds of new cases every day. Stay in and cop on, says Paddy. Another text to our WhatsApp number. Good morning. Am I being really unrealistic, hoping to get to Britain in early August? Are all of us that have booked holidays in July and August fooling ourselves? I've been so looking forward to my holidays to get me through these months. But am I only setting myself for further disappointment? Thank you for the continuous updated information, Damien. I know you can't and don't have answers for everything. I don't have answers for that either. We just don't know. I think we're going to have to wait and see what the government advises later this week, ahead of next week, and take it from there. A couple of people asking, are chiropodists open? We'll get more information on that tomorrow. And a number of people had been on about, what was the type of stretching? It was frozen shoulder, yes. And this person texted, stand beside a wall, slowly raise the offending arm up the wall until it reaches its limit, then gently lean against it. Do this 3 times daily and it stretches the frozen shoulder muscle gradually. It took several months, but after trying physio and injections, it worked very well and I've never looked back, says this person. So frozen shoulder basically is when there's a torn muscle, it knits back in the wrong way. So stretching it gives a chance to expand and get back to normal. So if you have that, stand beside a wall, raise the offending arm up the wall until it reaches its limit, gently lean against it. Now, some good advice there. See what you think. 083 333 975. Next we have a woman who really wants to contact a Waterford woman called Tina. This is a really good story. Now, in a second, I'm going to be talking to Lily, who's looking to try and talk to Tina from Waterford. Firstly, a couple of texts. I'm not going to get to all the texts before the end of the programme. Good morning. The reason that people want a relaxed lockdown is because our government did a half-arse lockdown from the start. They told over 70s to stay in their homes and then they allowed airports and seaports open for people to come into the country. No wonder people are so peed off. Double standards, says this texter. Lily, good morning.
Hiya, I'm delighted you phoned me. I can't believe it.
It's lovely to talk to you. You're in Bettystown, are you?
I'm in Bettystown, yeah, in County Meath, yeah.
Lovely.
And I'm looking for, you probably know already, do you? I'm looking for a woman called Tina.
Okay.
On holiday.
So listen, let's explain this. You were in Porto del Carmen, the hotel in Lanzarote in March. You met a woman called Tina from Waterford who was there with her family, and you really hit it off. And you want to try and get back in touch with her.
I do, yes. She did ring me, but I had to drink too many and I never saved the number. And I really, really wanted to get back to her. I was a bit stronger than Lanzarote to drink, you know. And I'm really wanting to get back with her, yeah. Oh, I've just made my life, I think, now, you know, if I got her back.
Ah. You know? So listen, it was just, you're Lily, is it Fitzsimons or Fitzsimmons?
No, Fitzsimons.
Fitzsimons. So you were literally in that hotel and you were having a great chat and you had a few too many, as you say, and you wanted to save her number. And you just want to...
Well, I was home, she phoned me, and I had too many drinks, and you know, don't even know how the conversation ended. And with the intention of getting back in touch and saving a number, and that was it. I didn't save the number. I forgot probably with the drink. But I remember when I met her for the first time, and I was just passing by where they were in the flat, and we were on the flat, you know, on the bottom. And she said, "Hello, Lorna." I said, "Where are you from?" She said, "Waterford." "Oh, I don't like Waterford people," I said to her. And she started to look, you know, and that's the way I go on. And she told me she's a technician. Okay. And I remember saying to her, "Well, I'm supposed to give you a clap or something for that." I hadn't got a clue what a technician was. But this is how then we clicked, really. And Dylan, her son, amazing.
And why did you say you didn't like Waterford people? Go on now, come on, Lily, come on.
No, I swear to God, I've never been into Waterford. No, I've nothing against anybody in Waterford or anybody, you know. Oh, no, it's only on the crack with them.
Yeah.
We had a really good time.
So Tina was there with her husband, her daughter, and her son Dylan.
Tina was there with... Now, first of all, Tina is blonde with glasses. She's a technician somewhere in Waterford.
Okay.
She had a son with her called Dylan, who had a beard, about 32 years of age. She had her daughter with her, never got her name, and her husband, and he had a beard. And they were married in September down in Waterford. And as far as we can remember, they were, after they flew home into Dublin, they had to go a long drive. I think they live in Tyrone now.
Okay.
So that's all I got. We were there from the 4th of March until the 11th of March.
Okay.
Tina left 2 days after me, I think.
So we're bound to know, and again, there's somebody out there that knows Tina, and who has a son called Dylan. You can't remember the husband's name, no?
It wasn't a husband. She had no husband. I didn't have a husband. We were sort of maybe thinking about changing our ways, you know.
And basically, if Tina can contact us, if Tina can get in touch with us through the station here, and what we'll do, Lily, is we'll hang on to your number and we'll try and get her to contact you.
Oh, great.
So describe her again to us.
I'd say it's very hard. Blonde woman with glasses, probably 40-something. Age-wise, I'm trying to judge her from Dylan's age, you know.
Yeah.
And her daughter was very long, dark hair. I think she may have said at some stage that she did a bit of work with people with disabilities. I think the daughter.
Okay.
You know, so they were going to Tyrone. So we had great fun. Really, the young stuff, and she was terrific, you know. You know.
Listen,
I'd love to. We have to go. You have to find her for me.
We will. We'll certainly. We'll put the call out, and if she's not listening, hopefully somebody that knows her is listening, and we'll get in touch with her, and we'll give you a shout back tomorrow. Listen, how are you getting on yourself?
I'm okay. Yeah, fine.
You find it tough?
The weather's great. The weather good up there. Yeah.
Yeah, it's not great now this morning, but how are you? Are you finding it tough, or how are you getting on?
No, I went out this morning for a little walk with the dog. I'm in here about 5 weeks, I suppose, but I found loads to do, you know, so I'll be ready now for the next holiday, please God, you know, if we get on to. I'll be an alcoholic the way I'm going. It's not a bottle of vodka, it's 8 cans of Coors, you know. But look, it makes you think how great you've had it, you know, when you see something like this happening, you know.
You'll have to cut back. You'll have to cut back on that alcohol now, Lily. Come on.
Doctor told me my liver and my kidneys are very bad. So I'm falling apart. I'm 71 now, you know. But everybody thinks I only look 60, so maybe I got the date mixed up, you know, of the year I was born.
Lily, we might give you a shout tomorrow, and we'll see if we can contact Tina, okay?
I'd be lying in bed at night and I hear him, come on, Tina, make a call. Because I made myself, I said, I'm very genuine, which I do believe about myself, you know. And it must be the first time I never took a phone number off someone on a holiday. And I'm sure she's saying, she's full of load of shit, that album.
Listen, keep your phone on later, and we'll catch up with you later for tomorrow, okay? God bless.
Brilliant. Thanks very, very much. Thanks a million, right? Please God, it'll work. Thanks a million.
Thanks,
right?
Lily. Talk to you later. God bless. Thanks very much. Lily Fitzsimon's there talking to us. Okay, so if you know Tina, let us know. Send us in a text 083 3333 975, or you can call Laura on 051 846 123. Our mission today is to find Tina. Hope you had a good show. Geoff is up next. Thanks, Julie, for producing. We will talk to you tomorrow.